welcome everyone to the next part of our Brain Health series, Suicide Awareness, Stop the Stigma and Start a Conversation. KSB Community Wellness brings you another wonderful presentation tonight with 3 of our KSB individuals. I can't even give you all of their credentials, they're so long, so we're just going to introduce these folks because they're going to have a nice group chat tonight with you, as well as share some wonderful facts, statistics, and let's turn these things around. This is Suicide Awareness Month. And so that's one of our focuses, as you can see. So coming tonight to you is Valerie Roberts. She's our licensed clinical social worker here at KSB in our behavioral health department. We have Dr. Wendy Soflo, who is our director of home health care. And again, as I shared, folks, these people have a lot of other certifications behind their name. We'd be here all night with those. So Laura Salzville is going to join us too, and she is our manager in our emergency department. So these folks are coming to you again, as I shared, facts, statistics, and they're going to share some of their own personal experiences that they've had. With that, I'm going to turn it over to you, Val Roberts, and you can start us off.
So hi, I'm Valerie Roberts. I'm a licensed clinical social worker, and we're going to start off with some introductions so that you know who we all are, why we're here, and why this is important to us. I've been in the KSB outpatient psychiatry and counseling for over 3 years now. I work with individuals, families, couples, on all sorts of brain health issues and concerns. Before that, I worked inpatient at KSB as well for 3 years on the psychiatric unit. So I have some experience there. And then I have experience personally with family and friends as well with suicide attempts and suicidal thoughts. And so I do have some personal experience as well. And then I will hand it off to Wendy to introduce herself.
Thanks, Val. I'm Wendy Sofalo. I am Director of Home Health Care and Care Coordination at KSB Hospital. I'm a nurse at heart, but I'm also a mom and a friend and a colleague of people who are just like you and everyone else who suffer and struggle, and I've had occasion to be the comforter for people who've lost loved ones to a successful suicide, and my role and goal here is to help everyone understand that it's not a special person or a unique person that has a role in helping each other. It's all of us. It's the ordinary people and the folks without degrees and without special training.
Hi, I'm Laura Salzville. I'm the department manager in the emergency department at KSB. And I've been a nurse for 26 years, and I have varied experience. I have a lot of trauma experience in my background. Trauma that you would normally think of, and also some brain health types of trauma. I have also experience with loss of a colleague, and just really want to learn how I can help my children who are losing friends to suicide. So I'm here, like the rest of you, to learn some more information, how to be helpful, and kind of find out, is there a wrong thing to say, or is it better to say something than to say nothing?
Great. Okay. So what we're going to do is on your PowerPoint here, you'll see we're going to look at the overview first. So this is everything that we're going to cover today. It'll switch back and forth between me talking about the PowerPoints, and then we'll have some discussion as well. So here's our overview. We're going to look at statistics, risk factors and warning signs. Then we're going to look at our language. Like, let's just talk about it. Let's eliminate the stigma and have the conversation. And then how do we help exactly? What do we need to do with our language? COVID-19 and the impact on mental health, and then as a result, potentially suicide rates, prevention strategies, treatment options, and resources. So that's where we will be going today. Okay, so I've got some statistics here that I want to pull up for you. Okay, so our first fact sheet here that we have shows the figures in the United States. And so this is giving you some different statistics such as that suicide was the 10th leading cause of death in the United States in 2019. These figures come from 2020. And also men died by suicide 3.6 times more often than women. However, women were 1.4 times more likely to attempt suicide. And I wanted to point this out. I wanted to point that specific fact out, the idea that men die by suicide more often than women. And so I kind of wanted to stop there and talk about that a little bit and see what your thoughts are on that, ladies, and then we can talk about what might be the reasoning behind that, men versus women. Any thoughts from the two of you?
Do you think it's access to the means?
Possibly.
Or do men look at more of a, something that couldn't be repaired or resuscitated or counteracted?
Kind of more of the feelings of hopelessness. Mm-hmm.
I feel like there might be an additional burden on men feeling like they're the breadwinner or the caregiver of the family, and when, especially maybe a career doesn't go right or there's a financial impact, that they don't feel there's a way out of it other than perhaps committing suicide and leaving their life insurance money to their family.
Mm-hmm.
In the emergency department, it seems, and I have no statistics, but it seems with when men come in after an attempt, it's usually something that was designed to be quick and violent, a handgun, a hanging. Whereas with women, it seems more subtle. Maybe taking some pills, maybe taking pills just to get sleep and get away from it, but maybe taking too many pills. I don't have any statistics on that, but just in the ERs that I've been in, that's been my experience with what I've seen in the emergency department.
And that would line up with what I used to see in the inpatient world as well, sort of that piece of there's all this shame attached for men where I'm not meeting my expectations financially as a father, whatever the case may be, and there's all that shame attached to it. And I think that, men tend to do, like you said, it's more lethal. It's more, I'm going to do it right, as opposed to women, it seems like there might be more of a, I don't want to die, but I just want this pain to stop, or I want to stop feeling overwhelmed, it seems like. So that would line up with what I witnessed in the inpatient world as well.
Or access to those devices. I mean, access to handguns women probably have easier access to
Medication.
medication, a medicine cabinet full of something.
That makes sense.
And what do you think about the fact that women are more likely to attempt than men, yet men are more likely to succeed? That's what I took from the statistics that you quoted. What do you think about that? Why would we see more women with the attempt? Is it because they feel more pressure to escape, or?
Well, and that's where I kind of wonder if it's that it's not as much that they're wanting to die, but more they're wanting help. It's more of a, I need help, I'm overwhelmed, I just want all of this to stop, as opposed to I really want to end my life and I see no way out. And I think that shame goes along with it for men, where it's like, I see no way out of this, I am so shameful about everything that's going on in my life, there's just no way out. Where I think women are more so looking for that help. Like there's still a little bit of hope there, it seems like. Yeah, so those are great thoughts about that topic. Anything else that the two of you want to say on that at all?
No, I was just wondering if you think women are perhaps found quicker than men. Just thinking from the mom or the grandma standpoint, it's rare to get 20 minutes to yourself. And I just wonder if maybe they would be more successful, but someone is looking for them sooner. I don't know, but I just think, just in your daily life, sometimes it's hard to get an hour to yourself, so.
That's a great point. I never really thought about that, but I could see that as being a possibility as to why. Let's see, other statistics here. For the most part, yeah, you can kind of look at these, and if you have questions, you're welcome to put them in the chat option. But as far as more statistics that I'll point out on this page, you're welcome to just look at them on your own. I'm gonna go ahead and go to the next one that I had here. And these are statistics that are specific to Illinois. So some of these were staggering for me. Like, they were very surprising. If you look at this sheet here for Illinois, it shows that suicide is the third leading cause of death for ages 10 to 24. It's the second leading cause of death for ages 25 to 34. The second leading cause. I just could not believe that number when I saw it. And then the fourth leading cause for people of my age group, which would be ages 35 to 54. Fourth leading cause of death for 35 to 54. What do the two of you think after hearing those numbers? Because for me, I was shocked to see that.
That is staggering, especially thinking that they start, did you say at 10?
10,
Mhm.
yeah, the age 10,
Yeah.
10 group is what surprises me the most.
It was shocking to see
Yeah.
that. So wanted everybody to see these numbers because these are important numbers to see, and this is exactly why we need to create the awareness and stop the stigma.
So do you think over time, and I don't know if these statistics show this, but do you think over time we're seeing it rise in all of these age groups? And is it because there are more suicides or more suicide attempts? Or is it just because people are paying more attention?
That's a good question too. I think that suicide rates are rising. I don't have the actual statistic here in front of me, I don't think. But I did read in doing my research that the rates are on the rise, but I don't know specifics as far as the specifics that you were referring to, but those are good questions to look into.
Yeah, Wendy and I were talking earlier about when I was in high school, I didn't know a single person that committed suicide. And whether that was a reality in my high school or rather my parents just shielded me from that kind of information, I don't really know. But with social media today, I know that not only are we hearing about it in our own communities, but my own children either know someone or know someone who knew someone, you know, within a very close circle that has either had an attempt or been successful. And I can't even wrap my brain around that. I don't know if it's on the rise or if we're just hearing more about it because social media. But it seemed, I was telling Wendy that it seemed like you used to hear about a teen suicide and it was tragic, but so far away you couldn't imagine it touching any part of your life. But now it seems like you aren't more than 3 degrees away from someone who's suffering.
That's true.
Which is interesting because when I was a kid, like a young teen, 20s, I can recall 2 suicides of people who were not close friends but acquaintances.
Yeah.
And then when my children became teenagers and they had friends or acquaintances, just someone they even knew, it was very hard for them to comprehend. You know, they just couldn't wrap their brains around how this could occur. So I think that it's something to be talked about, certainly not, and I hate to even say the word glorified, but it's real, and it may be one's own experience that you never have that occur in your youth, and it might be someone's experience that they do have to deal with that and have those questions about how does this happen and why does this happen and how did no one know that? You know, how did you not know that this was going to occur?
Right. Yeah, and we will actually move on to risk factors, actually, as far as that goes. So That's a great question. How did people miss it? Like, what was going on? What are people missing? And I think that that's an important place to go, is to talk about risk factors and then warning signs that we may miss. So we'll talk about risk factors first, which will be part of that, but then getting more specific about actual warning signs too. So some risk factors that we have here: brain health issues. If you're more susceptible to depression, depressive episodes, anxiety, substance use problems, then you may be more likely to have a higher risk of suicide. Also, traumatic brain injury being included in that as well. Serious physical conditions such as chronic pain, that can be difficult for people. I know that I've worked with clients in my office who've struggled with chronic pain for years, and they feel hopeless and they feel like there isn't anywhere to turn. And so I can see where chronic pain would lead to thoughts of suicide. The other thing that I have listed on this slide is environmental factors. So stressful life events. This is something that I saw all the time on the inpatient unit. A stressful life event would lead somebody to be hospitalized on our inpatient unit because they were having thoughts of suicide or had attempted. And the two of you have probably got experience with this as well. So we would see people come in and they would have been going through a divorce or an extreme loss or something traumatic. And so something in their environment brought them to that place of hopelessness. Prolonged stress, like a trauma, bullying that's going on. And access to lethal means is another one. Speaking of prolonged stress, I wanted to throw in there, and we'll talk about COVID a little bit more lately, but that is a place where we can look at prolonged stress. Either of the two of you want to say anything about that?
As you were mentioning all of those, I was thinking, okay, COVID. Let's
Absolutely.
just check all those boxes. And just anecdotally, I see an increase in patients with a desire to talk to a social worker in our work in post-acute areas, or exhibiting symptoms of not feeling they want to take the initiative to take care of themselves or adhere to their medical plan. And I think those are all symptoms that we're seeing because patients are feeling the pressure and the prolonged stress and concerned about family members and finances and jobs and getting sick and being isolated from their families. So I think that, we're seeing all those things, and it was so funny when you mentioned those. I'm ticking all the boxes in my brain.
Definitely. For
Well,
sure.
and I think just the unknown aspect of COVID, as we learn more, things change, but then the information's in a constant state of flux, so you're never quite sure what the current recommendations are this week. And I think most people can find the reserve to get through something that has a time limit on it. They can say, okay, if I can make it 10 more days, then X, Y, or Z will happen.
Absolutely.
But we have absolutely no idea week to week or month to month what COVID is going to make our lives look like. We know it's probably here to stay in some form or another, but just the open-endedness of finances and work and family and fear of getting it, fear of giving it to someone else. I hear that the most. I run into a lot of people that aren't that I'm healthy, I'll probably be fine, but I would feel terrible if I gave it to my grandma or my grandchild or X, Y, or Z, So there's just so much unknown. It's just so much extra pressure right now. And people, it's just, there's no expiration date on it.
And I think you are so on the right track there, because we've been talking about this as well in the outpatient setting, that it's that prolonged, we don't know when this is going to end. And so people, like you said, if you have a time frame, okay, I can make it through that.
Right.
But no end in sight. People are just feeling so hopeless and overwhelmed with life right now. So you can see that this would be a great example of how it can correlate with increased stress, feelings of hopelessness, increased risk of suicide, unfortunately.
Well, and those can feed into substance use and all of those factors that then again add another layer of
Yes.
problems.
Yes, definitely. You're
Yeah.
absolutely right.
I think that's very easy to seek a little relief through a substance or alcohol or something, and then before you know it, you've compounded the problem, and you feel like it's beyond your control.
Right. And so the last thing that I have mentioned on here under environmental factors is exposure to another person's suicide or sensationalized accounts of suicide. And then I put in parentheses 13 reasons why. Are you both familiar with 13 reasons why at all?
No, I'm not.
Okay, so it was a television show that Netflix put out a couple years back, and it goes through a teenage girl who kills herself, and they glamorize it, basically. And so it's a very controversial TV show, and when it was put out, we saw an increase in suicide attempts with the teenage population because this was a teenager that had went through this experience on the TV show. So this is an example of how sensationalized accounts of suicide can actually increase the risk for people to harm themselves. So moving on to other risk factors, historical risk factors, family history of suicide, previous suicide attempts, childhood abuse, neglect, or trauma. Religious beliefs, so the belief that it is noble to harm yourself or to kill yourself for the good of the religion, and barriers to accessing mental health treatment. So this is kind of my soapbox, so I won't get on my soapbox too much, but this is major, access to mental health treatment. It's so hard to get in to see somebody very quickly in the mental health world or in the world of brain health. First of all, there's a stigma attached to getting help. Although we've come a long way in our society as far as that goes, there's still a stigma attached to getting help.
Yes, absolutely. And I can share that someone very dear to me had struggles of a number of different factors, pressures on this person, was voicing suicidal thoughts. Don't know if there was exactly a plan at that point in time, and that's always kind of a key thing, but had taken a handful of pills. And at that point, I had just barely started at KSB. And for a very nanosecond, crossed my mind, what am I going to look like when I take this person in? And, of course it was, there and gone. And it was, okay, we're going to get in the car and go. But then I felt this terrible guilt of how could I have even thought that?
And you're in healthcare.
How did that come to my mind at all? When I consider myself to be pretty logical, reasonable, grounded person why would that have even come to my mind when I'm talking about, life or death? Obviously we, packed it up and went to the hospital and all is good, but I think that's when you talk about stigma, it's so ingrained. It's so ingrained that it's really, really scary to me that, for me, knowing what I know and having seen what I've seen as a nurse and a nursing coordinator and oh my gosh, I even worked in a neuro ICU unit, and we've, went the whole, very traumatic experiences there for folks. But to even have had that flit through my mind was, it took me aback, and it still does.
Yeah, and you're in healthcare, and we still struggle with that in healthcare, even with that stigma. So the average person who's not in healthcare, the amount of stigma that they may experience, I would imagine, would be even greater. But not only the stigma, I mean, to access mental health services can be very challenging depending on insurance, the cost, the wait lists. I mean, there's just so much to it. To get into a psychiatrist can take 1 to 3 months, depending on the area.
Especially here. I mean, we're not in Chicago where there's a plethora of providers to choose from.
Absolutely. Yes, the rural setting, another barrier. For lots of reasons. We could go into lots of those reasons too, but yes, there's stigma attached, and again, I won't get on my soapbox, but that is
Just a little bit.
just a little. Okay, anything else on that we want to say before we move on? Okay, so let's talk about warning signs then. Close to risk factors, but a little bit more detailed. So these are warning signs to look for if your loved one is struggling or you believe that they are struggling. So we'll just start with increased use of alcohol or drugs. This is probably a fairly, what's the word I want to say? It's a fairly important warning sign. If you see increased use of alcohol or drugs, or maybe your loved one is hiding alcohol or drugs, that is a place to start a conversation. And again, we'll talk about how to talk about the conversation in the next couple of slides, but this would be an area, if you see increased use of alcohol or drugs, to start asking questions. That could be a warning sign, could be. Other warning signs could be isolating from family and friends and withdrawing from activities. This is difficult right now because we're all isolated and we're all sort of withdrawing from each other and doing our own thing. So this is going to be a little bit more difficult to notice, the isolation and the withdrawing from activities. Something that's sort of more well known is when somebody starts to give away their possessions. If they start to give away their favorite instrument or their prized possession, they start giving these things away. That's a warning sign that they could be thinking of ending their life. If they're saying goodbyes to people, some of these are more obvious warning signs than others. If they're saying their goodbyes, you might want to start having a conversation about what's going on. I haven't heard you talk about this before. I haven't heard you talk like this before. Looking for a way to end their lives. So if they start, if you're noticing that they're making comments about life isn't worth living, you know, if I had a gun, you know, they may make obvious statements like that, but looking for the means to do that. They may talk about feelings of hopelessness, trapped, or having no reason to live. That's what you were talking about there, Laura. And an increase in mood disturbance, such as anxiety and depression. So if you notice they're feeling more anxious, more depressed, again, it doesn't necessarily mean that they are having those thoughts, but it's an area where you can start asking questions. And something I'll add on here as well that's not listed on the slides is sometimes people appear happier than they have in a long time. So sometimes when people make the decision that they want to end their life, a sense of peace comes over them. So if you're noticing a big change in mood, even if it's in terms of happiness or feeling a little more calm, again, you just might want to ask those questions. It doesn't mean that they are having those thoughts, but have the conversation. Anything the two of you want to add to warning signs at all?
No, I think that covers it, and I just think you have to keep talking.
Exactly. Yes. So
if you're worried, talk.
So let's talk about that. So let's talk about our language. Yes, thank you. Okay, so language. Should we talk about suicide? Sometimes people worry that talking about the topic will put the idea in their loved one's head. I often hear parents say this, actually. If I talk about it, then they're going to get the idea to do it. I have not seen that to be true for the most part. Usually, people are relieved that you ask. People are relieved that you ask the question, are you having these thoughts? Are you thinking about hurting yourself? That sometimes will come with relief. So don't avoid the question, actually, because people may be relieved that you asked the question. It's important to talk to your loved one in private. Don't ask the question in front of a bunch of people. You know, I've heard some really distasteful ways that people have done this. I've heard people ask the question like in front of a bunch of family members, which is so embarrassing. And I would love to open up if somebody asked me that question in front of all my family and friends. You know, it's just not going to get the result you're looking for. So talk to them in private. If you're worried about someone who you know may be considering suicide, you simply can ask them, are you thinking about suicide? It's okay to ask the question directly. That's actually preferred. Direct communication is best, like it says here. And don't minimize their feelings. You don't want to get caught in the trap of saying to them, it's not that bad. It will get better. Those are statements that you really can't prove, and it really just invalidates the person's feelings and makes them feel like you're not really listening to them. So take them seriously and tell them that you care about them. One thing I'll say that I noticed on the inpatient psychiatric unit is patients really wanted to feel loved and supported. And so just that family member telling them, I care about you and I love you and I don't want you to hurt yourself, could be huge sometimes, because people didn't feel that love and support. They feel like people are against them. They feel that shame. So for a family member or a friend to reach out and say, I do care about you, that's a big deal. So what do we say to somebody if we have thoughts or we are concerned that they are suicidal, or if they tell us that they are suicidal? Again, we want to take them seriously. Stay with them. Don't leave them. If you really feel like they are going to harm themselves, stay with them and remove any lethal means. So remove any guns, remove any knives, or things that they could use to harm themselves. If you know that they have history of taking medications, remove the medications. Ultimately, get help. Don't put this on yourself. Talk to a mental health provider or take them to an emergency room. There's a national suicide hotline that's available, and there's the National Suicide Talk Line as well. So take it seriously, and but again, don't put it all on yourself, and get help. Thoughts on any of that from you guys?
I was thinking when you were talking about people kind of feeling isolated and there's not a lot of family members getting together for their normal functions, if you have a large family or touch. It's so interesting how quickly our mindset changes during COVID. I just ran into a coworker in the hospital an hour ago I haven't seen in months, and we were like, oh, it's so good to see you, and we're hugging, and then someone walks by and I'm like, nope, we're not hugging during a pandemic. You know, you feel the need to apologize for that because you're not sure that's okay right now.
Mm-hmm. That's a good point. Yes. So it just makes everything a little more complicated right now. Well, that's an understatement.
Yeah.
Yeah.
It's all out the
A
window.
little more complicated, that's all. Yes, that's a good point. So let's move on to COVID, actually, unless you have anything else that you want to say about that topic.
I think it can be exhausting that every decision you make all day long, you're weighing the risk and benefits and the current information.
I'm sure.
And
Well,
am I doing the right thing, and are people watching me?
Exactly.
Yeah.
We're measuring inches. How far apart are we?
Yeah.
Is it, am I doing it right? Am
Right. Yeah. Was I closer than 6 feet for 10 minutes, or was it 8 minutes, or was it 11 minutes? You know, are people watching me? Everyone's trying to do the best they can with the information we have, but
So much more pressure on people.
it's exhausting,
Mhm.
you know, to think every decision. So if you already have a lot on your plate and you're already feeling hopeless and depressed, then sometimes that's just a little too much for people.
I agree. Yes, it can be very overwhelming. Okay, so let's talk about COVID and mental health concerns. We'll just talk specifically now about COVID-19 and mental health concerns. So in June 2020, the Centers for Disease Control and Prevention reported an increase in adverse mental health conditions associated with COVID-19 in the United States. And so certain populations appear to be at higher risk of worse mental health outcomes, such as increased substance use and suicidal ideation. So I want to point out that really we don't have the actual statistics yet for 2020. It's too soon to have those. But this is what we have so far, that it's increasing substance use and suicidal ideation and mental health issues. So as a result, it could increase suicidal attempts. But I thought it was interesting that they pointed out that certain populations appear to be at higher risk, such as younger adults, racial and ethnic minorities, essential workers, and unpaid adult caregivers. So just looking at this list here, we're all essential workers. So anything the two of you would like to say about that as far as the increased risk of suicidal ideation and substance use issues with essential workers?
Well, I think that when you're under this type of stress, it really decreases your ability to problem solve in the moment. And I think that sometimes at the end of the day, people may joke about going home and having a drink, but you might get to a point where you actually think, I can't problem solve one more minute. I need to go home and have a drink and have a meal. And then, you know, whereas in the past, maybe you had the physical and mental reserve to go for a walk instead. But now you're exhausted mentally and physically. Caregivers are, you know, I don't know that the general public knows what it's like to spend 8 or 12 hours in PPE every day. And it seems silly to complain about it because we are so blessed in this area and at KSB to have everything we need. We have been safe from day one. You know, KSB's just been wonderful about acquiring what we need. But it takes a little bit of a physical toll.
It does.
You know.
So, and like the slide says, keep talking, stop the stigma, we are all in this together. We just have to talk about it. We have to keep the conversation going because we are all in this together. We are all stressed out. We're all experiencing the unrest of the world right now. So, good to keep talking about it. Okay, so prevention strategies. Check in with your loved one often. If you're concerned, maybe call them more. Send them a text. Stop by. If you can't go inside, wave through the window, get on Zoom, FaceTime, whatever you have to do right now to check on people because people are feeling isolated right now. Encourage socialization and suggest activities. That was a little tongue-tied. This is difficult right now too because you're limited to what you can encourage as far as socialization and activities. So that's a little more difficult right now. Promoting self-care and specifically hygiene, like if you notice that somebody hasn't maybe showered in a while, one of your family members, gently encouraging them, hey, maybe just take a shower, you'll feel better, that type of thing. Watch for those warning signs that we discussed. That is huge. Watch for those warning signs. Offer to ask or offer to help with basic needs such as grocery shopping. So you can offer to take them grocery shopping, stop to get their medications, whatever you can do to make them feel less overwhelmed. And then brain health treatment. So trying to get them help if they need help. And that's actually a little bit more on the next slide. But do you guys want to say anything else about prevention strategies before I move on to that part?
No, I think that I say no and then I start talking. See how I am? Yes. And along those lines, it's being able to think about not just the folks that you're concerned about, but the folks that you just don't see often. And as we're sitting here, I'm thinking about family that I haven't contacted in a while. And, you know, if something were to happen, I would say, how did I not know? And it's because I didn't reach out. So that kind of convicted that, you know, I need to be more proactive. I mean, I work a lot and I try and take care of my immediate family, but there's a whole lot of other people out there that I should be paying attention to. And I think, you know, that interaction then it will help me too.
Yeah, that's a good point. Yeah, checking in with people that you don't talk to regularly. Good point. Okay, so treatment options. This will be about the last slide that we talk about here. And so there's inpatient treatment and outpatient treatment. For inpatient treatment, that's going to be more short-term, crisis-centered, safety being a top priority. And so that would look like a 3 to 5 day stay approximately on an inpatient psychiatric unit. And that is like your top crisis-centered, highest risk type treatment. Not appropriate for everybody. But if it's a crisis and it is a matter of I am suicidal and I am planning on taking my life, then inpatient treatment is probably your best option. You can call the hospital, no, you can call 911, you can call a hotline, or you can go to the emergency room. Those are your options if you're in immediate crisis. For outpatient treatment, there's more options there. You have partial hospitalization programs. We do not have that here. We are working on intensive outpatient program. That is to be seen in the future for us. Individual and or family therapy, psychiatric care, that the two of you think I've missed as far as outpatient options for treatment. And last, I'll just put up the slide for our resources. These are our local resources, Sterling, Rock Falls, Dixon area-ish. So those are for your benefit there. We have counseling services, psychiatric services, and then some online and texting availability. These are where we got some of our info, some of our sources, and thank you very much.
So thanks everybody for joining KSB Community Wellness tonight as we talked about a very serious topic of suicide prevention, but what a great group of ladies that helped us through this. This is just a small group of people here at KSB that are passionate about suicide and about helping people with suicide problems or other behavioral health issues or brain health issues, I guess we should say. Again, we encourage you to ask questions. Just put them in the chat, in the comment part of Facebook, and one of these folks is going to get back to you and answer your questions. You did a wonderful job, and again, thank you, and thank you all for